Sunburn is generally caused by spending too much time outdoors without wearing proper sunscreen. You may have spent a long period of time at the beach, or maybe you were swimming at the pool all day, or maybe you were just doing various outdoor activities like yard work. Whatever reason, in this video, we're going to discuss over-the-counter options you can take for sunburn. But make sure you watch to the end as I'm going to outline some non-drug therapies and in what order you should use them in combination with the over-the-counter products. Stay tuned. Greetings, health experts. This is Brandon E., your Pharm.D., and welcome to my YouTube channel. In the last video, we talked about lifestyle changes that you can make to help with sunburn. We talked about seeking shade, if possible, if you're doing outdoor activities. We talked about wearing sunglasses. We also talked about the optimal times to do outdoor activities so that you can avoid the UV rays of the sun when they're strongest. But what if you practice some of the lifestyle changes and you still get sunburned? Let's talk about the over-the-counter products available. The first products we're going to talk about are pain relievers. Aspirin, acetaminophen, and ibuprofen are all good pain relievers to take if you have pain or discomfort associated with sunburn. Again, they can help with pain, they can help you if you have a headache, and they can reduce your temperature if you have a fever. If you have swelling associated with your sunburn, lean more towards aspirin or ibuprofen, as these agents have anti-inflammatory properties, whereas acetaminophen does not. The next product we're going to talk about is hydrocortisone cream, and this comes in 0.5% and 1% over the counter. This is a steroid applied to the skin, and it helps with some of the burning or discomfort associated with sunburn. It can also help reduce swelling, and it may help to speed up the recovery process if you get sunburn. The next product we're going to talk about is aloe vera, and this is a very popular product when it comes to sunburn. During the summer months in the pharmacy, this is probably the most common product I hear people ask me for. What aisle is the aloe vera on? Where can I find aloe vera? I got sunburn, so it's a good option. And this agent helps to moisturize the skin, it's soothing, and it has anti-inflammatory properties. But when using aloe vera gel, it's good to use it when the skin is moist. So I would recommend using it after a bath or a shower. If you've tried some of these over-the-counter products and they work for you, let us know in the comments. And if you're enjoying the content and you want to become a health expert, be sure to subscribe to the channel. So now let's put everything together. Let's say you've gotten sunburn, what should you do? The first thing you should do, and this is very obvious, get out of the sun, preferably indoors. Think about if you touched a hot stove. If you had a stove on in your kitchen and you placed your hand on the stove and it was burning your hand, the first thing you would do would be to remove your hand from the stove. Or let's say you touched a sharp knife. The first thing you would do would be to remove your body part touching the knife from the knife. It's the same way with sunburn. Get out of the sun as soon as possible to avoid further damage to your skin. The next thing you want to do is, if you're in a lot of pain or discomfort, take an over-the-counter oral medicine like acetaminophen, aspirin, or ibuprofen. These agents will help with some of the discomfort and pain that comes along with sunburn. Number 3, you want to make sure you're staying adequately hydrated and drink plenty of water. When you get sunburn, this draws fluid away from the rest of the body, so you want to make sure you're drinking a lot of water to prevent dehydration. The next thing you want to do is you want to take a cool bath or a cool shower, as this can be soothing to the skin and to help relieve you from discomfort. The next thing you want to do is use a moisturizing cream or gel like hydrocortisone or aloe vera. And it's also a good idea to use these agents after a bath or a shower, as I just mentioned, when the skin is moist. If you don't want to take a bath or a shower, apply a cool compress to the area for maybe a few minutes and then apply the hydrocortisone or aloe vera. And you can also find combination products available as well with hydrocortisone and aloe vera in the same cream. The final tip I'm going to give you: if you get sunburn and your skin blisters, do not pop the blister, as this can help the skin heal and can prevent you from getting infection. Now, we're not done yet. To get the best treatment, you want to apply the lifestyle changes we talked about in part 1, as well as the over-the-counter products we talked about in this video from part 2. This is Brandon E., your Pharm.D. Remember to drink water, and hope this video helps.